Hi, I'm Dr. Kay Chandler from Cornerstone Clinic for Women. I practice here at Baptist Health in Little Rock. I wanted to make sure that we are all aware of September being Ovarian Cancer Awareness Month. I know a lot of people have heard of ovarian cancer. They get nervous about ovarian cancer, but maybe they're not aware of what are some signs and symptoms that they need to be watching for. So that's one of the things we want to bring awareness to at this time of the year, and really all year, but this is just a special time we focus on that. But some of the symptoms that women need to be watching for, if they have persistent pelvic pain that does not resolve, a day or two of pelvic pain and it goes away, that may not be anything. But persistent pelvic pain, abdominal bloating, GI symptoms, gastrointestinal symptoms, stomach problems that don't seem to be going away, and maybe they've been checked out by their doctor and it doesn't seem to have anything to do with their stomach or their bowel. Could be a symptom. Or even sometimes feeling full when they're just barely had something to eat, that can be a symptom. So those are all things that if a woman's experiencing those symptoms, she needs to see her doctor. And oftentimes you can do tests like a pelvic ultrasound or a blood test, a CA-125. Not necessarily every woman needs a CA-125 every year. Not everybody needs a pelvic ultrasound every year. But those are some signs and symptoms that would make you more interested in doing that. Another thing I think that a lot of people are not aware of is that there is testing now to screen for what's called the breast ovarian cancer syndrome, and it's a genetic test. And actually, the guidelines have changed on that. In the past, if you had more than one family member and they were under a certain age, you might qualify or you might be a candidate for that testing. Now, the evidence is if you have any ovarian cancer in your family, you really qualify to be tested. I use the Myriad MyRisk, and it's actually a blood test that will tell you if you carry certain genes or mutations in genes that are associated with ovarian or even breast cancer, colon cancer, uterine cancer. But since we're talking about ovarian cancer now, and that is the one that gets covered under all cases, I'd highly recommend that because it really can make the difference of getting, whether you might have your ovaries out when you're done childbearing, whether you might just have a pelvic ultrasound every 6 months or yearly, but it just could help make sure that you're getting all the screening that you need so that you can help prevent that.